So thanks again for everyone for joining us. So our speaker today is Monica Thompson, who has worked as a respiratory therapist for the past 11 years. She has worked in home care for her whole career, first in Regina, Saskatchewan for 5 years, and then returned to PEI, and has worked at Vital Air for the past 6 years. Monica works both with the home oxygen program and the sleep apnea therapy, and greatly enjoys helping islanders with lung conditions. Monica is married and has a 6-year-old daughter and a 7-year-old wiener dog. Her and her family spend most of their weekends walking in the woods or on the beach. So thanks so much for joining us today, Monica.
All right, thanks, Julia. So I'm going to talk to you guys about sleep apnea and a little bit of COVID-19 as well. I think most of you are CPAP users, so a little bit of a review for you. What is sleep apnea? So sleep apnea is a serious disorder in which a person will stop breathing or take pauses in breath or even episodes of shallow breathing periodically throughout their sleep. The pauses in breath are called apneas, and they typically last between 10 and 30 seconds. And in severe cases, they can last up to a minute and even longer. So if you think about trying to hold your breath for 30 seconds right now, it can be pretty tricky. And then if you think about your body doing that over and over again throughout the night during your sleep, it's a huge stressor on the body. So sleep apnea is a very common disorder. The Canadian Lung Association says that approximately 1 in 5 adults have at least mild sleep apnea. So mild sleep apnea is categorized as having those apneas or shallow breathing episodes 5 to 15 times every hour of their sleep. And then 1 in 15 have at least moderate sleep apnea, and moderate sleep apnea is categorized as 15 to 30 of those apneas every hour of your sleep. And then there's also severe sleep apnea, which is 30 and above times per hour. So roughly 25% of Canadians are at risk of developing sleep apnea. And the greatest risk factors for sleep apnea are obesity, having a large neck circumference, having a smaller than average airway. So this could be caused by having enlarged tonsils, even an enlarged tongue, and the uvula, the hanging ball there at the back of your throat. If those are large, that can increase your risk of sleep apnea. Plus having a small or recessed chin. Your age can be a risk factor. So the older you are, the higher the risk of having sleep apnea. If you have a family history of sleep apnea, you're at greater risk. And if you're a smoker, you're at greater risk for sleep apnea as well. So there's 3 main types of sleep apnea. The most common type is obstructive sleep apnea. So this is where there's actually a physical obstruction in the airway, and that obstruction is caused by the tissues and the muscles in your airway that relax while you're sleeping. They relax with everybody when you're asleep, but with some people it relaxes just a little bit too much and can actually cause that airway to become completely blocked and stop the breath from being able to pass through. Then there's central sleep apnea, which is where the message from the breathing center of your brain is a little slow to get to the breathing muscles. So your diaphragm and your chest muscles to tell them to breathe. So some potential causes of central sleep apnea could be congestive heart failure and stroke. It can be medication related, particularly pain medications like opioids. And then a lot of times we don't know what causes central sleep apnea. And then the third kind is complex sleep apnea. So complex would be a mix of the central and obstructive sleep apnea. So the common signs and symptoms that we see of if somebody has sleep apnea is excessive daytime sleepiness. We often have people complaining that there's loud snoring, followed by silent pauses. So this is caused by when your airway is relaxing, it can cause the airway to vibrate, and this causes that snoring sound. And then when the airway completely collapses, then you have that pause in breath. And then it's often followed by a big gasp or a choke while you're sleeping. So we often hear bed partners saying they're noticing this in their partner. We have poor concentration and memory loss, headaches in the morning due to your oxygen level being lower through the night. This can cause those morning headaches. Another big thing we see is frequent visits to the bathroom. This is also very common with sleep apnea. So basically, sleep apnea stops you from having a restful sleep that your body needs to be healthy, to stay healthy. So how it does this is every time you have those pauses in breath or those episodes of shallow breathing, your brain tries to wake you up. So it's going to bring you out of that deep stage of sleep that you're in, the REM sleep. And the REM sleep is what your body needs to feel rested, to rejuvenate, to heal itself. So it brings you out of that stage of sleep and it brings you into the lighter stages of sleep. So you may not notice it happening every time you have a pause in breath because you're still in those lighter stages of sleep. But by disturbing your sleep like this constantly throughout the night, it doesn't allow your organs to rest. So this is where the bathroom trips come in. So your kidneys are working overtime all through the night, causing increased trips to the bathroom. It also makes your heart work a lot harder through the night because your oxygen level is lower and it's trying to get that lower amount of oxygen pumped throughout the body. So it causes an increased workload on your heart, which can then lead to high blood pressure, uncontrolled high blood pressure most of the time. And the high blood pressure will then often lead to increased risk of heart attack and stroke. It can also be difficult for your body to process your blood sugars. So we often see sleep apnea, untreated sleep apnea contributing to type 2 diabetes. And then that lack of REM sleep disrupts memory formation. So you can often see cognitive impairments and memory loss with sleep apnea. So due to all this, with untreated sleep apnea, especially with moderate to severe untreated sleep apnea, we tend to see an increase in the number of car or work accidents, the increased risk of cardiovascular disease and stroke, high blood pressure, type 2 diabetes, early death. So in short, it is a very serious condition and potentially life-threatening condition. And so it really should be treated. And unfortunately, there's no cure for sleep apnea. There's only treatment. So, and the treatment only works while you're using it. So it needs to be used consistently in order for it to work properly. Once you stop using it, even if it's for only a few nights, you're just going to go back to the way you were without your treatment. So now to talk about the treatment, as many of you know, the most common treatment and really the gold standard in treatment for sleep apnea is CPAP. So CPAP stands for continuous positive airway pressure. And what it is, it's a machine that you use with a mask. And there's all different types of masks. There's full face masks, nasal masks. And it's important to get fitted properly for those masks in order to make the therapy work. So what the machine does is it gives you pressurized room air. It's just room air. There's no oxygen involved unless that's needed as well. But most of the time it's just room air. And that air acts like a splint in your airway to keep the airway propped open. So it splints it open and prevents that tissue collapse from happening throughout the night. So it keeps your airway nice and clear and allows that air to pass through a lot smoother, makes you breathe a lot more efficiently through the night. Consistent CPAP use can have pretty quick results. When we start people on CPAP trials, We sometimes see significant changes happening within the first week to 2 weeks of therapy, but that's if they're using it consistently all night, every night. So yeah, we see results really quickly, and it's so nice to hear people coming in and saying that they're sleeping all night. They didn't wake up at all through the night, and they haven't done that in years, or they're not getting up to go to the bathroom through the night. We often hear as well too that their blood pressure or their blood sugars, those levels are dropping, or they're even back to normal. So it's really nice to hear those things, and that can happen really quickly if you're a faithful CPAP user. So just like everywhere else, sleep apnea is very common on PEI. It roughly affects about 9,600 people. And unfortunately, there is no provincial support for sleep apnea treatment here on PEI. So we're very fortunate now with the refurbishment program here that Julia is going to talk about here in a little bit, through the Lung Association. This allows people without private insurance or who may not have the financial means they're able to access treatment for their sleep apnea. So it's a wonderful thing that we're able to have here now. So I'm going to just talk a little bit about COVID-19 right now. Just a little review on what it is, and then I'll kind of tie it in on how it can apply to sleep apnea. So COVID-19 is it's an infectious disease that's caused by the novel coronavirus. It attacks and damages your respiratory tract. It is very contagious, and it is spread through droplets and aerosols that are created when an infected person coughs, sneezes, or even just speaks. So the symptoms that we're seeing, new or worsening cough, shortness of breath, difficulty breathing, fever, chills, sore throat, runny nose, sneezing, congestion, headache, muscle, joint, and body aches, a general feeling of unwell or unusual tiredness, acute loss of sense of smell or taste. And then we can also see nausea, vomiting, and diarrhea as well. So a year into this, I think we're probably all pretty good with our masks and prevention and stuff, but just a quick review. So we want to protect ourselves and others. So we should be wearing a properly fitting mask. So to properly use your mask, you should avoid touching the front of the mask itself. You should just try and touch the strings or the straps when you're putting it on and taking it off. You want to ensure that there's no gaps along the side of your face, and you want to make sure that your mouth and nose are covered completely. It doesn't work if it's just sitting underneath your nose. You gotta make sure it's covering your nose too. And don't share your mask with others. With the reusable masks, like the cotton or fabric masks, it's good to wash those after each use, and you want to throw away disposable masks after each use. And it is important to wash your hands after you take your mask off. You should wash your hands with soap and water for at least 20 seconds, or if that's not available, have some hand sanitizer. We're seeing that pretty well everywhere now, so you should have access to some hand sanitizer. We should be continuing to social distance, keep at least 6 feet apart from others. Again, wash your hands often, soap and water for 20 seconds or hand sanitizer. You should cover your mouth and nose when you're coughing or sneezing using your elbow or a tissue. Don't have your mask on. And avoid touching your eyes, mouth, and nose. Stay home if you don't feel well. That's an important one. Just avoid spreading anything by staying home. Another good thing is to download the COVID-19 alert app through the Government of Canada. So this will alert you if you have been in contact with someone who has tested positive for COVID-19. So it's a great way to trace the spread of COVID-19. It's safe. It doesn't have access to your name or your address or phone contacts. It does protect your privacy. And finally, smoking. You should avoid smoking. Smoking reduces your lung capacity and increases the risks of respiratory infections, which can also increase the severity of the respiratory diseases and illnesses that you might contract. And then just to tie it back to sleep apnea, smoking can affect sleep apnea as well. It can increase your risk of developing it, and it can increase the severity of sleep apnea as well, because it damages the upper airway muscle function by increasing inflammation and increased mucus production in the upper airway. So smoking will also affect sleep apnea. Our vaccine program is underway and going strong, which is wonderful. There are numerous demographics eligible now for the vaccine. And to find out if you are eligible, you can call the number here, that 902-368-6414, to get some information on the vaccine. There are some underlying conditions that if Islanders have these underlying conditions, they may be given priority for the vaccination. So the respiratory ones that could be one of these conditions are cystic fibrosis, severe asthma, severe COPD, some cancers, and organ transplant recipients. So if you have any of these conditions or other conditions that may be on this list, you can call the number to find out if you're eligible for a vaccine. What to expect when you are going to get your vaccine. Oh, sorry. There we go. All right, so you should wear your mask, of course, and you could wear a short sleeve t-shirt or have something that your upper arm is easily accessible. You'll probably be provided with an information sheet from Public Health about the vaccine that you're getting, so good to review that before you go, and don't go if you're feeling unwell. So now to tie in sleep apnea with COVID-19. Having sleep apnea doesn't increase your risk of contracting COVID-19. However, if you were to contract COVID-19 and you had untreated sleep apnea, especially the moderate to severe sleep apnea, and this goes for any infectious processes or disease, you would be at a higher risk of developing more severe symptoms if your sleep apnea is untreated, mainly because your body just wouldn't be strong enough to fight the infection as it would if it was getting good quality sleep. So make sure you use your CPAP machine. It helps your overall physical health. If you are a CPAP user and you develop COVID-19 symptoms, you should contact your physician, and you could even contact your CPAP specialist or your provider just for some information on how to, if you should be continuing or how to go about caring for your machine. If you're able to use your machine, you should continue to do so. Sometimes with respiratory symptoms like coughing, sneezing, congestion, it can be difficult to use your CPAP machine, but if you can, you should use it just to make sure you're getting that good quality sleep your body needs to fight off the infection. There should be no issue with using your CPAP machine if you were in a private dwelling, like if you're in your own house or your own apartment. But if you're living in a care home, there may be issues with using your CPAP machine, and if you have COVID-19, just because the CPAP machines increase the spread of respiratory droplets and aerosols. So there might be an issue there, but your care home caregivers will be able to help you out with that. And now this is one of the most important things I think we can talk about at any time with COVID-19 or just in general. It's so important to regularly clean your CPAP equipment. If you just think about you're placing that mask on your face every night for several hours a night, and you're coughing and you're sneezing and you're drooling in your mask, not cleaning leads to bacterial growth, mold growth, and just it gets dingy and it's not going to work as well. So, and that's what you end up inhaling all through the night too. So it's just so important to clean your machine and your mask especially. So you need to take the time to clean. And for the most part, the cleaning regimen should involve daily cleaning of the mask cushion. So the soft part that's actually touching your face. You should clean that daily. You can get CPAP wipes, which is a gentle wipe with no scent or anything to wipe the mask, or even CPAP sprays. You can get that as well. And it's a convenient way to wipe your mask. You can simply use a soft cloth with a little bit of soap on it too. You should empty your water chamber daily and put fresh distilled water in every night. You should completely clean your mask. So that includes your the headgear, the cushion, any hard plastic parts. That should be cleaned weekly, as well as the tubing and the water chamber. So you should clean those things once a week with like a mild dish soap is fine, a mild soap and warm water once a week. And then you should change the actual any CPAP machine that I know of has a filter. And this filter should be changed roughly every 3 to 6 months. That's probably going to depend on different manufacturers. And you can check with your CPAP provider about this and about any of this stuff. You know, if you have any questions about cleaning or anything, talk to your provider. They'll have the answers for you. But yeah, those are very important in your CPAP therapy. Cleaning won't just benefit your physical health. It also makes your CPAP equipment last longer and work better. So clean that CPAP equipment. It's going to be good. It's going to make everything last longer and make you feel better. So I think that's it for me. I think I can pass it off to Julia now.
All right. Hi, everyone. So I'm just going to briefly just go over the Lung Association's refurbishment program. This information might be relevant for you, or it might be relevant for somebody in your life that you could share this information with. So we're the PEI Lung Association. So we are a local charity that supports islanders with lung conditions. So it helps islanders to promote, improve, and participate in their lung health through education, advocacy, and research. Our charity's PEI has been around for about 73 years and nationally for over 100 years. And our mission is to assist islanders to promote and improve lung health. Next. Okay, so our CPAP refurbishment program, or our sleep apnea refurbishment program, helps low-income islanders without private insurance who suffer from sleep apnea but cannot afford treatment. And it relies on donations of CPAP machines no longer being used. Our program started in 2019 and it's been around for close to 2 years here, and we've been able to give out almost 140 CPAP machines in that time, so we're really proud of that. So I'm not going to read these all out, but this is the program criteria for our program. So basically we need to get some documentation saying that you have sleep apnea from your sleep clinic, as well as we send out a program waiver that you have to complete and return. You know, we just want the people that receive these machines to use them, have them calibrated by a sleep specialist, and that kind of thing. I just wanted to say also that, you know, the sleep clinics we work with are all a great resource for information, like Monica was saying. So, you know, if you do have questions and you want to talk about that, you know, you can reach out to the sleep clinic that you're working with as well. Next slide. So how our program works is that we collect the machines from islanders across the province. So we have drop-off sites. The primary drop-off site is our office in Charlottetown. It's in the Voluntary Resource Center downtown. We also work with the 22 Lions Clubs across PEI to help us collect machines, and then they help us bring the machines to our office in Charlottetown. We also work with Island Respiratory Services, mostly as a Summerside drop-off spot. So refurbishment. So we get a lot of questions about how we do this. So we work with currently we work with the Dalhousie University Respiratory Therapy Program, and their students come into our office in Nova Scotia, the Nova Scotia Lung Association, and they work with their instructor to refurbish the equipment, and then but currently we're working on bringing this same model to PEI. So it's all the refurbishment is done by certified respiratory therapists. So soon we're going to be able to offer this on PEI, as it's been a bit cumbersome with COVID-19 trying to transport the CPAP machines back and forth from Nova Scotia. So once our machines are refurbished, clients can either pick them up at our office in Charlottetown, but typically we send them out through the mail. So we just charge a $35 shipping fee. There's no charge for the actual machine. And in this program, we don't also cover the cost of mask and tubing. So clients are still looking at, you know, a few $100s to cover those costs. However, that is, you know, much better than some of the costs that can be found for an entire CPAP machine. So we really hope that, you know, our program will help people that would otherwise not receive therapy. So I'm just going to tell a little story about one of our clients. Her name is Katie. She called our office when she was just 25 years old. As Monica said, you know, the majority of people have CPAP when they're a bit older, but there are some genetic factors or physical factors that so individuals can have CPAP or sleep apnea at an earlier age. So she was her doctor sent her for tests. They didn't really know what was going on. She was very tired. She was putting on weight. She was falling asleep, you know, even at work, just really feeling lethargic all the time. And she was becoming depressed because of her symptoms and just the tiredness and the unknown of what was happening to her. So she did become diagnosed with severe obstructive sleep apnea, and her sister saw a TV commercial about our program, and she told her to contact the Lung Association. So she went through our process, and a few months later did receive a CPAP in the mail from our program. So, you know, since receiving the CPAP and being on the therapy, she says that, you know, she no longer feels drowsy while driving, which is a huge concern both for herself and the other people on the road, and also has lost weight and feels a lot more energetic. She would say that her overall mental health has improved, and she's feeling much happier and is able to go to work without falling asleep, and has a lot more energy to direct towards her goals. So I think that, you know, this is just an example of someone who was diagnosed with CPAP or sleep apnea earlier in life, and just that, you know, our program really helped her, and, you know, will continue to help her as she gets older. And we're just really fortunate that she found out about our program. So please share the word. So thank you so much for joining us. We're going to send out a short survey just following the session, just to ask you a couple questions about what you thought of our session. This is our first time offering a sleep apnea specific webinar. So, we are thinking about maybe offering more in the future on different topics, but we're just wondering kind of if people would be interested in signing up if we do. Yeah, so thanks so much for joining us. And thank you so much, Monica, for presenting. I definitely learned a lot, and I'm sure everyone else on the call did as well.
Thank you for asking. Thank you for the opportunity. And yeah, if anybody has any questions, they can reach out to Julia and she can let me know, or yeah, very good. Thank
Perfect. You. Okay, thanks a lot. See everyone later.
Thanks, everybody.
Bye.